Welcome to our panel discussion about discovering careers in community health and social services. Thank you very much for coming. My name is Liz and I'm with the Career Center here at York. This panel is being co-hosted by the Stong College Office of the Master as part of the Create Your Future program and the Faculty of Health Student Caucus. So we'd like to thank them for their partnership. And this event is also part of a series that includes industry insights and career conversations, and both of which are sponsored by the Alumni Relations Office. So we'd like to thank them very much for their generous support as well. And if you'd like any information on upcoming events, you can check our website at yorku.ca/careers. So without further delay, I'd like to introduce our panelists. So to my right, we have Stephanie Agosta, who's Career Services Coordinator at Interval House. She's a York alumna. And we've got to Steph's right, we have Morris Beckford, and he's Community Programs Director with Access Alliance Multicultural Health and Community Services. And to the right of Morris, we have Sangeetha Navaratnam, and she is Program Assistant with Toronto Rehab and also works with the University Health Network. And she is soon to be an alumnus, or an alumna. So she's graduating with an MSW in April. So welcome, panelists. Thank you so much for being here. So I'll get the panel started by asking each of you to introduce yourselves briefly and tell us a bit about your role and your key responsibilities within your current organization. So let's start with Stephanie and move down the panel this way.
Okay, hi. So I work at Interval House, which is a shelter for women and their children who have fled abusive relationships. I actually work in the community programs department, and I oversee the BESS program. So although my title says Career Services Coordinator, what I actually do in a month, for 2 weeks, I facilitate a job search readiness and a job search skills training program. And for the other 2 weeks of the month, I am coordinating other workshops. I'm doing intakes, outreach, and a lot of administration. So that's the gist of my role and where I work.
Oh, great. I wish I was down here, actually. It's so much easier when you're at last. Okay, so I'm the Director of Community Programs for Access Alliance. It's a multicultural community health center. But the health center has two pieces. So there's the health piece of it, and then there's the community program piece of it. My job is to manage and direct the community programs piece of it and make sure there's a linkage between the health sector section and the community program section. My job is heavily administrative, which I don't hate. I like it, but it has me at my desk the majority of the time. A lot of it is staff management. A lot of it is paperwork and funder management and managing funds and making sure that we get funds into the agency. So my day is a mixture of connecting with outside funders and making sure there's some kind of connection between primary health care and community programs, and the connection between myself, the funders, primary health care, community programs, and staff, which is very interesting.
Hi, so I actually work at the University Health Network, which is a conglomeration of 4 hospitals in downtown Toronto. So the hospital that I work at is Toronto Rehab, which is a non-acute care hospital. I am in an administrative role there. I've got 2 positions actually that I hold. One is in volunteer resources, where I screen and recruit volunteers for the hospital, and then my other role is actually on a unit. I take care of staffing and payroll on the musculoskeletal unit of the hospital.
Thank you. All right. And so now I'd like to ask you each to briefly share an overview of your career stories with us. So you can tell us a little bit about your experience working in community health organizations or social service organizations, how you became interested in this field, and also where you started in your career. So that could include your educational background. So why don't we start with Sangeetha and move this way?
So I have a really winding path to where I am. I have two undergrads, one in psych and soc, the other one in education. I also have a master's in education, and now I'm doing my MSW. So I've been in a lot of school. I've worked in like banks and for the federal government and a lot of different places. Essentially, when I finished teachers college, I couldn't find work as a teacher. I couldn't find steady full-time work as a teacher. But I was noticing that healthcare, I saw a lot of administrative non-clinical positions being posted. So I started to apply for those positions. And I got my start at Mount Sinai Hospital in their human rights office. And I worked there for about 6 months. And then when that contract was over, I was headhunted by someone to work at Toronto Rehab. And so from an acute care hospital, I went to a rehab hospital, and I've been there ever since. I've noticed that there's more clinical and managerial positions for people with clinical backgrounds than non-clinical. So about a year and a half ago, I decided to go back and get my MSW just because I was looking to see where I could go, and I saw that there were more positions in one particular area. So now I'm finishing up my MSW. With the hopes of sort of moving on in that clinical capacity.
That's me. Well, mine is just as winding, or maybe even more winding. I also graduated from the ed program, so I have a BA in history, and just a cautionary tale. I don't know if I should say this, but stay away from those soft degrees, please, for God's sakes. So I have a BA in history, and I have a BEd in junior intermediate education. When I graduated as well, it was during the time when they were saying that they were looking for black teachers and black male teachers, and I could not find a job. I had a great resume. I knew I had a great resume, but I still couldn't find a job. Most of my friends actually went to England or went overseas somewhere to find a teaching position, and they did, but it was also during the time where my passport had expired, and just graduated from university, no money to get anything renewed, all that good stuff, so I was pretty much stuck in the country, so I stayed. So I had the BA, the BEd, no job, and then a half-time position or a part-time position came up in a community agency called Doorsteps Neighborhood Services as an after-school program developer. So applied for that, got that, had the half-time, then learned that the best way to get a job is to actually do the networking thing and making sure that you know how to network and connect with principals out there. So I did that and finally got a half-time position teaching. So I had a half-time position teaching and a half-time position doing an after-school program developer, both a relatively precarious position, which is really disturbing. So I did that for a good number of years, and then finally had to get a big boy job to grow up, and went and really hunted for a full-time teaching position. I hunted for a full-time teaching position, got it, hated it. And then went into private education. Got that, didn't like that either, so I figured, okay, it can't be the teaching of the kids or the admin, it must be me, because this is my second try at it. So I sort of gave that up. But before doing that, I got an email from Doorsteps. The former ED, the ED who was there before she was leaving, she's finally retiring, and she sent me an email to tell me that she was retiring, and I sent her a 4-page letter saying, I want your job. I got her job. I did that for about 4 years, and then this job that I'm doing now came up on the radar, and I swear, no lie. In the job description, it says, perfect for an executive director of a small agency. And guess what I was? An executive director of a small agency. So I applied, and I got it, and I guess that's where I'm right now.
Okay.
Like Morris and Sangeetha, I have also a winding path. and my big girl job didn't come until 2 years ago. So I graduated York University with an honors BA in psychology and communications. When I graduated school, I did not plan. I did not know what my next steps were. I actually enrolled in a program for youth to start their own businesses. And so I spent a couple years launching a small business while still working part-time. I worked for several years in retail positions, and it wasn't until about 2010 when I had an aha moment and decided I needed to do something with my life that was more, that meant more. On a hunch that since I had so many struggles throughout my life, trying to figure out what I wanted to do and where I should go and what I should do for work, that I could help other people figure this out, that I could learn how to help other people figure this out. So I went to George Brown for the Career and Work Counselor program. And after graduating that, I began working at the college as an intern in their career center. The reason I have the role that I have today is actually a friend of mine who forwarded me a posting that she thought sounded like a good fit for me, and it was a perfectly good fit. Although I myself did not have experience in social service work directly, nor was trained as a social service worker, the organization took a chance on me based on the education that I did have and based on the things I had done in my business and in my previous work experience. And it's been an incredibly steep learning curve in the past 2 years, and I couldn't be happier. I love what I do. It is challenging. It's a lot of paperwork sometimes as well. But when you do get to see results with clients, it's very rewarding.
Thank you all for sharing that. I like hearing the twists and turns of people's career stories. I think a lot of people's career stories are like that.
Not when you're living it, it's horrible.
But it brought you to where you are today.
Yeah, I suppose I should appreciate that. But, yeah.
Okay. So at this point, I'd like to open up questions to the floor. So if you've got a question, I just ask that you stand up so that everyone can hear you. And if you have a question for a particular panelist or the whole panel, I would just ask that you specify that too. So if it's for just one person or the whole panel. Who has a question? Yes.
Yes. Hi, fellow BA in history. So do you have any advice, like what advice do you have for people to not wind up in the same winding path as you do, as you all seem to have wound up on?
Okay, so how do you get a more direct route to the positions that you're in?
Yeah, should I go first?
Sure.
It's sad, but it's true. It really is about making sure that you connect really early in your university years with those people or with that job that you want to do in the future. I learned that a little bit later than I think a lot of people, just how crucial it is. I mean, I'd always known that it was important to make sure you connect with people, but just how crucial it is a tiny bit disturbing. Even now, and you know, some friends that I'm talking to, I can't say it ever happens to me, just how quickly your resume gets to the top of the pile by making that connection really, really early in the game it's interesting, to say the least. So I'd say make sure that you connect with what you want to do, and don't be afraid to do it. The worst thing you can hear is a no, right? And whatever, who cares? Just get on with it. But connect, send an email to that CEO or that ED or that director, because you just never know, right? You hassle them enough, your resume will get to the top of the pile. I can almost guarantee you. When we're doing hiring at our agency, I look for those people who send me a resume, a personal note, because it says to me that I'm about to hire a go-getter, someone who's not going to be afraid to connect with the funders, who breathe down your neck regularly, and who's not going to be afraid to send that email or make that connection really, really quickly. So I'd say do that, or at least start with that.
So network.
Mm-hmm.
Does anyone
Sure.
else have? Yeah.
Sure. I think for me, to have avoided this, I would have done my research. I think that that's huge. When I went to Teachers College, there were reports that, so I'm non-Catholic, non-French speaking, that it was a 20% higher rate, right? Like there were reports out there, there were things I could have read and could have done to read the market, but I didn't. And I went to Teachers College and I came out and I couldn't find a job, right? Whereas with this degree that I'm doing right now, I did my research, even just looking at what's being posted out there, right? Like, okay, I want to be a social worker, but am I going to have a job, right? And I think that's the biggest piece of advice I would give you is look at what people, who they're hiring. Like, are they hiring, administrators? Are they hiring teachers? Who are they hiring right now? Yeah.
Yeah, I would echo the same sentiments. Research really would have helped. I went to university to pursue the psychology and communication studies because it was just the next step. It was just the next thing to do after high school, but I didn't really know why, and I didn't really know what I wanted from it. I encourage you and I urge you to try on as many different career hats as you possibly can by meeting people who do those kinds of things. Mm-hmm. You really never know what can happen from having a conversation with someone. It could change the course of your life. And this is a shameless plug for the Career Center, but use their services. Learn how to conduct an information interview. Learn what networking is. It's not really that big of a mystery. Luckily for you, if you do intend to pursue work in social services or health services, most of us who work in these industries want to help people in general. And so if you reach out to us and you ask us and you're genuine and you're looking for advice or you're looking for a 15-minute conversation, most people will say yes. As you said, you will get no's, but it's worth a shot. Because, as I said, you really have no idea for sure, 100%, most of you, how it'll turn out, what will be the immediate goal past school. Yeah, I think if I had spent a lot more time planning and using the resources of the school, meeting with career counselors, and also meeting people who did work that I found interesting, and volunteering. Volunteering really is another great way to meet people, expand your network, and get a taste of what it might be like to work at a particular organization or company.
Great. Thank you for the Career Center plug. There are a lot of things that the Career Center can do to assist with both research and networking. Right now, you've all taken advantage of today's opportunity to network with professionals, and we also have another program called TASTE, which is an acronym for Take a Student to Eat, where you can apply to go for an information interview with an alumni who's doing something that's interesting to you. And if you don't see someone on the list who looks like they'd be a good fit for you, send me an email and we'll reach out so that we can start making those connections. But you can also be doing it on your own and making those phone calls. And for labor market research, we have resources for that too. So if you want to talk to me at all about Career Center services, please do. What other questions do we have? Yes, in the back.
Hi, thank you for coming to speak to us. My name is Hamid. I'm doing my MBA. But I'm doing my MBA in nonprofit and social sector. So, exactly. So that's not something that you usually hear going together. But the one thing I'm struggling with, so I completely agree with the response you gave to the first question, research and connect with people, volunteer. So I'm actually doing all that, or I think I'm doing all that. But what I'm struggling with is finding the passion. So what exactly is it within the social sector that I want to be doing? And I feel like I could do a lot better in terms of research and connecting with people once I know where exactly am I heading. But do you, I don't know, it's probably a very big question, but do you have any suggestions on how to do that? Because I'm attending all these events, I'm education or social sector within Schulich, within York in general, but I'm still struggling to find some specific direction.
So how do you zone in on that area that you're passionate about, and how do you discover what that is?
In addition to connecting with the CPC.
In addition, okay. Who'd like to?
You're the MSW.
Sure,
so
okay. So I work with a lot of volunteers at the hospital that are actually looking for careers in healthcare, right? And so one I would say is definitely volunteer, right? But don't volunteer, you know, with a vague idea of helping someone. Like go in and volunteer and say, you know, I want to know, you know, what a social worker does. I want to know what it feels like on a unit, or I want to know what the foundation does that raises money for the hospital, right? Try to get something that's more than just like, I'm going to serve tea and cookies to patients. The other thing I would say is, this is something that someone once told me. This would be the old-fashioned way of doing it, but whenever you're reading an article or see a newspaper magazine, and it's something of interest to you that you're like, oh, that's interesting, clip it out and, you know, put it in a folder, and after a little while, look through it and see if there's a theme. So what you could use right now is you could use Pinterest, right? You could use technology to do that, right? And see if there's some sort of guiding principle through all of those things, and that might be where your passion is. Because if you're gonna spend time reading something or looking at something in your spare time, it would be nice to get paid to do it, right? So that would be my advice.
Just on top of that, I would say, this may not really be helpful, but being patient with yourself. Sometimes it takes doing a lot of things you don't know you don't like until you do them. And so you have to try those things before you can find what it is you're really passionate about. Truthfully, that's what I would suggest.
Yeah, I'm on my second career, and I didn't love the first one. I like this one a lot better, and I'm sure I'm not going to be here for more than the next 5 years. My boss knows, everybody knows. Just because I'm not 75, right? I'm just in my 30s, and I want to try a lot more. I want to try many more things. And I don't know how old you are, but I'm sure that you've got, well, you might get hit by a bus later, I don't know. But chances are you have time, right? You can try new things and try different things and see if they work for you. It might just work for 5 years. Give it a try.
So this theme of trying on hats keeps coming up, and you don't have to be in the same place for the rest of your career.
Yeah, you don't have to know. You don't have to know just yet. You'll find it, and it's impossible to tell when you will. But.
I mean, in nonprofit too, the way things are going, you'll probably will not find a job that's going to last for more than 5 years. It's just funding comes and it goes, right?
Yeah.
So.
What other questions do we have? Oh, right there. Sorry, there's sun in my eyes.
My name's Catherine. I'm another BA in history.
Oh dear.
And I'm trying to figure out what's the next stage. Do I need more education? I've spent the last 3 years volunteering actually through the Rainbow Health Network. Yeah. And I know that volunteering is really good for making contacts, but also in developing my skills. How much weight do you feel a lot of employers, like I know that I'm going to need more education, but also in terms of utilizing the skills I've learned in my volunteering, how much weight do agencies tend to place on this?
So how much weight do agencies place on volunteer work and education? Yeah,
do they weigh similarly? Is there a high value?
I can't speak for all, but I do know that with a lot of nonprofit agencies that are hiring, they simply ask that you have that level of degree, that level of education. It's not always a mandatory that it has to be within a specific program area. And so in that case, if you have extensive experience working in the field, but not the education per se that exactly backs it up, I think it could easily, if you display it to the employer in the right way, could raise some eyebrows, you know, catch some interest. I think experience is worth a lot, whether it's paid or unpaid.
It depends. It depends on how much time I want to spend teaching the new person. If I don't have a lot of time to teach this new person the skills that they need, and there's a volunteer who's been with the agency for a good number of months or years, they're well ahead of whoever's coming in, forgetting about their education piece, because that piece takes up a lot of the agency's money to train them, to get them in, and then you get somebody in, and 6 months they're gone. You know, here's a volunteer, I know they're passionate, and I know they've been here for a long time, so they must care about what they do and care about the agency. They're gonna most likely get the job. Unless, of course, I have to hire a master's student. There are some projects, especially federal projects out there, who will require you to hire a master's student, and then you have no choice. You really just have to hire a master's level student. That's a situation where you've got a volunteer who's thinking of going back to school to do the master's, may slip through and be able to get through it. But outside of that, I'd say the volunteer has, for me anyways, has the edge.
So I'm biased because I work in volunteer resources. Because it's a large institution that I work at, our department has a little bit more push and pull. So like this morning I was just talking to a colleague who was saying, oh, you know, one of the doctors is looking for an administrator. And I was like, okay, well, why don't we see if one of our volunteers is looking for work? We have had a lot of volunteers who have actually successfully transitioned into roles at the hospital. Because sometimes it's not a matter of who you know, it's who knows you, right? So if when something is coming up and someone's talking, it's like, oh, I have a volunteer, or I know someone who's actually foreign trained to do that, or who's finishing up school to do that. And they're around and you see them. And so I do have we have quite a few success stories. But it's also buy-in from management who believe that it's a good way to sort of almost like promote from within and have that sort of mentality. So we do have that buy-in. Yeah.
I would also, sorry, I just wanted to add one thing. This goes for anyone that's volunteering. Oftentimes, as a volunteer, you might get stuck doing repetitive tasks, things that don't expose you to the things you want to learn about. So advocate for yourself professionally and respectfully, but ask to be shown things that you want to know. Don't wait for someone to show you or to expose you to a certain type of work or activity that's related to that organization. Network within the organization once you're a volunteer in there. Because you can always move around, well, not always, but in a lot of cases you can move around to different departments and shadow or work with different people.
Mm-hmm. That's great advice. So you can ask if there's something you want to know and learn, and you want to gain experience in a certain area, you can ask. Did that answer your question?
It does, thank you.
Who else has a question? While you're thinking of your next question, I can ask another. In your respective fields, what trends do you notice in terms of types of positions available at the entry level or areas of growth? Maybe Sangeetha, would you like to start us off?
Sure. So at the hospital, the administrative non-clinical positions, most of the requirements in terms of education are high school. I have never seen someone hired with just a high school degree. Most of the people who are doing the administrative non-clinical positions either have an undergraduate degree, sometimes 2 undergraduate degrees, sometimes they're doing their undergraduate degree and their master's part-time. Everyone is like overqualified essentially. So I think, and that's sort of, you have to remember the hospital is a very educated space too, right? Like that's kind of the currency there. So sometimes you might see job postings that look like, okay, it's a high school and I have a university degree or whatever, I shouldn't apply. But at least at my organization, the University Health Network, like that's now becoming minimum for entry-level positions. Yeah,
Okay.
that's one of the trends that I've noticed actually.
Okay, great. And then is it mainly administrative non-clinical positions that tend to be those entry-level positions, or are there other types of entry-level positions as well?
There are other types, but most of them are clinical, or specific in terms of like a certain type of skill.
Okay.
Like HR, like
Okay.
you'd need an HR certificate.
Right.
Finance, you'd need a background in finance.
Okay. Maurice?
I'm not sure that I've noticed any trends as far as our agency is concerned. What I do know is coming, and this might be really good for you, is a situation where a lot of the executives in nonprofit will be retiring over the next number of years. I think some of them are already retiring, so lots of director positions are popping up, or CEO positions, or COO positions in fairly large multi-million-dollar organizations, which are like corporations now. So that's happening. I think what's going to happen next is smaller agencies, and I think it's happened to me, smaller agencies, EDs and CEOs of those smaller agencies are going to be uploading to those bigger ones and leaving those spaces that need to be filled over the next 5 years. So I think that's coming down the pipeline, which is a good thing.
Okay, so there will be more space for entry-level roles or more
Yeah,
positions
it's
available.
going to start pushing up.
Okay, that's encouraging. Steph?
I am fairly new to this field, so I do not feel comfortable speaking to trends, although in my own organization, I can see they're beginning to succession plan and to talk about, you know, who will be the next, who will be the next at the top. So I can agree there. As someone who helps clients look for work, often in social services as well, one thing I notice for sure in the ask is that level of education being a minimum of university or college, but there's always the or a commensurate level of experience. So don't downplay your experience, whether it seems completely off base to what you are actually applying for or not, because you can make it fit. If you spend time with your career counselor and if you spend time pulling out the skills and the abilities and the activities that you've done in your work, you can find ways that it can transfer over that will make sense to the person that's reading that. So I think there is hope, even if it seems like you have a history of work that is non-related or volunteer experience that is non-related. You have learned a lot and you've done a lot in those things, so you can find a way to transfer it over.
What other questions do we have? Okay. Well, I would like to ask then, what specifically would each of you say that is the most enjoyable aspects of your work? And along with that, what would you say is the most challenging? So let's start with Sangeetha again, is that okay?
Sure. Yeah. So my first role in volunteer resources, I love working with, it's mostly students that I work with, and I love it. I take a lot of pride in sort of the accomplishments of my students. So a lot of my students have now gone on to, they're occupational therapists, they're physiotherapists, pharmacists, doctors. I've written reference letters for them. I'm just very happy to see that a lot of them have taken their experience and are now professionals, and some of them have even come back and work at the hospital. So that's something that I really enjoy. When I'm on the unit, I really enjoy the patients. The patients are amazing. Because it's a rehab facility, we rehab patients back home. So we get them as best as they can be physically, and then they go home. So that's one of the nice parts of my job. One of the things I don't like is the paperwork and the bureaucracy. Just this morning, I had to call finance and be like, which form do I fill out for, reimbursement? Is it 252 or 257? And like those, because it's such a large organization. It's, Regional Cancer Center, Rehab Hospital, and 2 general hospitals. And so sometimes to get an answer for something as simple as which form do I fill out will take me days. So that's the part that I don't enjoy.
There's a lot. I really do love my job, as much as you can love a job. The autonomy, I think, is one of the most important things. I get to move however, wherever, try new things. Even if they fail, learn from the failures. I think it's the most important thing about my job. Successes, I was just looking at our targets a while ago, and a number of our staff are performing well above targets, 110%, 120%, which is amazing. I think the one thing I don't like about it is failure, which you can learn a lot from, but I still don't like it. And people who aren't hitting their targets, that really, really bothers me as well, because if you're getting money to work in communities, those communities are depending on you to do what you say you're going to do, and a part of doing what you say you're going to do is hitting those targets if you set them in an equitable manner. So that part bothers me a little bit as well.
Mm-hmm. And do you find that the nature of the way that staff need to do their work, or that you need to do their work, is influenced by those funders' expectations?
Everything you do is influenced by funder expectations. Whether you want to believe it or not, it is. They're giving you money. What I think it becomes disturbing when it controls your mission and your vision, right? So once it's not controlling your mission and your vision, then I think it's a healthier relationship.
Okay, so you have to balance that,
yeah.
Doing what the organization set out to do, but also
meeting funder expectations,
right.
Yeah. Because, funder expectations, well, many of them are similar expectations to what the communities really want. And if you're sitting down and writing a grant, those targets are set by you. So a bit of that is also controlled by you. So if it's, like I said, if it's not controlling your mission and your vision, and you're not running after money just for the sake of running after money, then it is what it is.
Yep. So one of the most enjoyable aspects of my work are the successes that I get to see with clients. Every month, a group of women go through the program that I facilitate, and we have a little graduation party at the end of it. And I'm always amazed each time at the change that has taken place over the course of those 10 days for each individual person. And I get to hear about it. It's really overwhelming and gratifying. Another thing that I really enjoy about the work that I do are the variety of tasks that I get to take on. So there's times where I get to hole up in my office and do administrative things. There's times when I'm meeting new people. There's times when I'm facilitating a class. So I really like that range. There's times when I'm mopping the floor. I work at a small agency, and today there was a leak and we had a huge mess to clean up. So I kind of enjoy that variety and that challenge where every day I don't just go in knowing exactly what's going to happen that day. Some of the more challenging things are work and life balance. So getting used to that common syndrome or idea of burnout and trying to avoid it, because it is exhausting work. Emotionally, it takes a toll if you let it cross into your personal life. So setting up those boundaries and knowing that the potential is there for that to happen in advance of going into a career in this field is good. And it's really frustrating when you can't find appropriate resources for a client. So whatever their specific barriers are, their very specific needs, there just might not be something that suits exactly what they're looking for, and that's frustrating. And it's also about working within the limitations of the way the current social services system is set up, and things that are offered and who's funded by who. Yeah, that's it.
Okay. What other questions are there? I had time to think. Oh, there's a hand up.
Yeah.
Yes, of course, please.
So, because you're exposed to these, so you talk about trends, right? But trends specifically in jobs. But what about the sector as a whole? the nonprofit and then the for-profit on the other end of the spectrum. But there's also this concept of social enterprise coming together. So is there anything you could speak to that? And are there resources where you can connect for them? Like, I know of the Center for Social Innovation or Mars Discovery District, or are there any prospects of that? What do you think about that?
Is that me? I have this love-hate relationship with social enterprises because I think a lot of times the social buries or kills the enterprise piece of it. And that's one of the problems I have with it. The other problem I have with it is that a lot of it is being spread in poorer neighborhoods, like economically poor neighborhoods, where I've seen folks try to start a social enterprise and they spend so much of their time building the social piece and not a lot of their time understanding that there's an enterprise piece. And we're in an economy where the dollar does rule, and if you're going to do a social enterprise, there has to be some kind of balance between the social and the enterprise. And if you're going to win, and I'm probably going to get a lot of flack for this, I hope not a lot of my friends see this. If you're going to win, you're going to have to spend a lot more attention on the enterprise piece and not as much attention on the social piece at the beginning, and slowly try to balance both of them out. So those are my problems. Outside of that, I think it's an interesting, certainly a potentially good model for agencies that have a bit more capacity to actually do it. Because if you don't have the capacity to do it, if you don't have the appropriate level of management to actually get it done, the staffing that you need to get it done, then it's just going to end up as a disaster.
What does it look like when a social enterprise spends too much time on the social?
It doesn't survive at all. Okay. It doesn't survive. It doesn't survive as a social enterprise. It turns into another nonprofit. So basically, you just become another nonprofit because you've eaten up all of your time doing the social piece. And I've seen people just burn out, complete burnout, because they now have no money. That's where the enterprise piece comes in. And whatever money they're making from that 10% of the time that they spend on the enterprise piece goes directly into their social piece. And it eats them alive.
Okay. Steph or Sangeetha, do you have anything you'd like to add about what you've noticed?
Not about social enterprise.
Yeah, okay. Okay. Yes?
What advice would you have for balancing work and life, as Stephanie said?
Okay.
Like, what advice would you have for that, so that you don't mind burning out?
Yeah, I think burning out is really common in these types of roles when you're working, especially when you're working with clients and you're right. Yeah, Steph?
Make a conscious effort to include the things that you like in your life and to not shut down those things because you're too tired or because you've just had a long day or a long week or a long month. Reach out to your social network, reach out to your friends, reach out to your family, and really push that, because I found personally that all the things to go when I started this new job were all the things that I enjoyed, my hobbies, my creative pursuits. And so it's about finding a way to push yourself to go to that yoga class or to do that creative writing or journaling when you get home or whatever it is that works for you. Put it in your schedule just like your work is in your schedule, because oftentimes, I don't know how it is for other people, but it's like I said, it's exhausting, and you may not feel like you have it in you to do anything else, to see your friends that evening or whatever it is. So yeah, I encourage you to respect, listen to your body, listen to what it is that's happening internally, and seek out and really enforce and make sure that you are continuing to participate in those extracurriculars, the things that make your life whole.
And you hear about that helping people do better at work too.
Absolutely, absolutely.
This might be completely inappropriate, but when I was in university, I was teaching at a summer camp. We asked the director a similar question, and he says, sorry for the offense, masturbate. That's not advice I'm going to give. I'm just saying it was advice that was given to me. Just do stuff that makes makes you happy. It's really, really important. Might not look like it, but I do work out 4 times a week. So I'm at the gym 4 times a week, just enjoying me, which is really, really important. If you have a family, and enjoy them. So, just do stuff that makes you happy, because it's really, really important.
So I guess my clinical hat a little bit, know the signs of burnout, right? Like, I don't have a handout with me right now, but this is something so I'm doing my placement right now at a mental health hospital, and that's one of the things I talk to my clients about. Like, do you know the signs of burnout, right? Like, that was something that I had to learn, and I'm myself just to monitor, right? Like, know when you're like, I don't care about going into work. I don't care about the results, right? Like, if it's something that you are passionate about, or a place that you usually love going to, and you don't care, that's one of the signs of burnout, like, so just educate yourself a little bit about, it's a real thing. It's not just, a term, it's something that people do get. So, yeah.
And how would you recommend that people prevent
burnout? Yeah, again, like, build it into your schedule. And also, I'm just trying to think. For me, it's about also letting the people around me know if I am feeling overwhelmed. So I do a lot. I'm in school full time. I work almost full time. But I let people know, like, I can only work until this time. I can only meet with you guys on these days. Like, I set boundaries. Like, my schedule isn't just open for everyone and anyone.
Mm-hmm. Yeah. Okay, so you're building time in, but you're setting boundaries, and you're not saying yes to everything.
Yeah, cannot say yes to everything.
Another thing that I would add is, hopefully you are lucky enough to find work with a team of people that are amazing and that you respect and appreciate, and you can use them also as a resource. If you have had a rotten day, or if you've just gone through a crisis intervention with a client and you want to unload that, talk to your coworker about it, because your friend or your partner may not understand, but the person who you're working with will. And just as we support other people, we need support too. So finding that within your own organization is really helpful.
What other questions are there? We have time for maybe one more. Oh, I thought that was a hand, but it's a hand up there. Oh, I can't see. Okay, thank you.
What are your thoughts on people with invisible disabilities? Do you recommend disclosing disabilities?
Okay. So do you recommend that people with invisible disabilities disclose them?
Will it affect the way you do your job? I think is an important question. If it doesn't, then really, I don't care. None of my business. When it comes to hiring people to work with our children, definitely going to be probing a little bit, legal probing, that is. But I think if it doesn't affect the way you do your job, or doing your job, then yeah, it's not my business really.
I would just add that if it in any way has something to do with what the organization does, or with the client population that you will be serving, if you feel it is in your best interest to let them know that in that way you can relate, then perhaps in those cases you may want to disclose. But I would agree, in general, you don't need to tell.
Yeah. I work in both mental health and physical, like rehab. I mean, you know, we ask about accommodations at interviews. It is up to you. I will just caution though, there is a lot of stigma around, you know, invisible disabilities, especially around mental illness. So, like, just be aware that that is out there. Yeah.
Okay, so it sounds like an individual decision, but it could be in your best interests to keep it confidential. All right, one more question.
Well, actually, just a little bit of a follow-up. So to expand on what you were saying, so say you're a client population around education or working with learning disabilities, is it in your best interest to disclose one's learning disability? Is there a lot of weight put towards lived experience?
What do you think?
I go back, well, piggybacking on what you've said a little bit, I go back to, you know, is it going to help you and your clients? Because if it's only going to help your clients, it's going to shoot you in the leg. I'd say don't do it. If it's going to help your clients, it's not going to hurt you, and it's not going to help you, and it's fine. It's up to you to make that decision. But I think you got to really be careful about not injuring yourself. You know, get out of your own way, sort of thing. Don't get into your own way for no real reason. You're not putting anyone in danger. You're not endangering any clients or coworkers or anybody. So, you know, keep your mouth shut.
So if there's a reason to disclose, you can disclose. But if there isn't, then
yeah, analyze for yourself. Is it going to harm you? Is it going to harm the client? If it's not going to harm either, if it's going to help you or help the clients, think about it from that perspective.